Hi students, this is Dr. Badrinath. Today's topic is Mr. Diabetes. Diabetes dash. Dash means why? Why diabetes mellitus or diabetes insipidus? What is the today's topic? By seeing the image, you can easily identify it is a diabetes mellitus, which is in relation with the pancreas. So today's topic is diabetes mellitus. Daily half an hour, if you walking or any exercise equal to 1,000 rupees. If you are doing a daily, 1 month your salary is 30,000. You may not accept this in this your age, but definitely you will accept this in the age of 45, 50. So you will come back to this video and again you will watch it. I will challenge you. If you are walking daily, then it will be the job is easy. Pancreas job is easy. So that it secretes the insulin that we know, islets of Langerhans, beta cells, islets of Langerhans secretes the insulin. Insulin is very important in the diabetes, that everything and all we know very well. Okay, right. We will see the same thing. Okay, right. So that's why do exercise. Okay. Uh, this is the diabetes mellitus. Diabetes day, World Diabetes Day, not national. World Diabetes Day is a November 14th. Now, N stands for 14, that so that the simple logic is enough to remember that N is equal to 14, 14 is equal to N. Diabetes. That's it. Okay. Yeah. What are the points I have covered in this class is the differences between the diabetes mellitus, diabetes insipidus. Types of difference, types of diabetes mellitus, causes of diabetes mellitus, what are the various reasons, why diabetes mellitus will come, symptoms of diabetes mellitus, many topics. See the baby here. Many topics we are covering in this class within a short span of a 20 to 25 minutes time. That's it. Symptoms of diabetes mellitus. Diagnostic tests. 5 tests are there. But key important tests are there. We know only blood sugar test. Okay, fasting, post. That we know. Only two things. That is only blood sugar. But remaining all these are very, very important. This test is very important. It is highlighted. A1C test, super A1 class A1 test is there. That and all we will see what is this A1 test, HbA1 test, A1C, urine glucose test, auto antibody test, oral. See many topics we are covering in this. Prevention of diabetes mellitus and treatment of diabetes mellitus also we will cover in everything is sweet and short, right? So we are studying a subject of social and preventive pharmacy, also called as a social and preventive medicine. Okay, it is important for all MBBS, medical, paramedical, nursing, everything. This is a syllabus, common syllabus for that. In that syllabus, we are studying the second chapter, diabetes mellitus. This is the highlighted point what I have covered. That is well. First one is diabetes mellitus and diabetes insipidus. Big difference is there. See, he is saying that big, very big difference is there. What is that beginning? See, diabetes mellitus is also called as a sugar diabetes, whereas a diabetes insipidus is called as a water diabetes. Water. Why it is calling as a water diabetes? Why this is called as sugar diabetes? That and all we will see. It is a sweet urine you will get. That's why it is called a thing. Sweet urine. Even in blood, diabetes glucose percentage is high, whereas here it is not like that. And never. Mellitus means sweet. Melt. Easily melt sweet. If you keep in your mouth, melt. Easily melt. Like that you can remember. Mellitus. Melt. Which melts? Sweet melts. Where? In your tongue. On your tongue, right? So this is a hormonal problem. This is also a hormonal problem. That is an insulin hormone. This is a vasopressin from hypothalamus. Regulates the body's retention. Here the problem is there. Here what they will get. Here sweet urine is the main criteria. Here they will get a bland, pale, insipid urine. Insipid urine. Pale urine. Very pale. I think you can understand pale. Okay. These are the differences. Okay. Differences is okay. Good. Similarities. What are the similarities? Excessive thirst is a common. Excessive thirst. Always drinking, needs to water like that. More, and this excessive thirsting is more in the insipidus. That is the main criteria, main characteristic of that. But however, here also thirst will be happen. Thirst, you will feel thirst. Depended on the hormone for control. This is a vasopressin problem. This is an insulin problem, like that. Okay, right. Pee a lot. You will go for urine a lot. This is also common. Pee a lot. These are the 3 points which are common. You want to go frequent urination. But if you are going a frequent urination, don't think that you are diabetes mellitus. You may be diabetes insipidus, because both are frequent urination is there. This is dangerous. Diabetes mellitus is a big difference is there. Very big. What's happening here? What's happening? See the diagram. Pumping. This is a sugar candy, sugar crystal, trying to pump inside the muscle from the blood. This is a blood circulation. Sugar is present in the blood circulation, in the systemic circulation. That sugar body is trying to pump into the muscle for exercise. It was not happening in the diabetes. That is exactly thing. So most of the sugar will not enter into the muscle. Always the sugar will be there in the this one in the blood, systemic circulation. So what happened? What will be the concentration of sugar in the blood? Go on increasing like that. In the muscles it is decreasing. In the here it is. See, when that's why you if you do exercise daily, if you do exercise, your muscles will utilize the sugar. That is a glucose. So that what happen? Muscles will uptake the glucose. So automatically your blood sugar level is decreased. That's why the doctors are saying, because no doctor will cut your muscle, your blood vessels, and make the pumping of your sugar into the. No such a great doctor is there. It's not happen. It's not possible. It's not at all possible. If you want to pump the sugar crystal from your blood into the muscle, only the option is you have to do exercise. That's it. Okay. So this is in diabetes mellitus glucose, sugar. This is glucose or sugar candy cannot be pumped into the muscle. Actually, muscle, this is a fiber structure, everything you know, it requires the energy. From where that energy means comes from the glucose only. Okay, body, whatever you have consumed, even the spice also, it will be converted into glucose only in the body, directly or indirectly, whatever it may be. That glucose only it is utilizing. You are using a spice granule as such, it cannot be utilized. It's not the thing. Okay, so high sugar is accumulated in the blood. So in the systemic circulation, you will get a high blood sugar. This is a muscle. This is a systemic circulation. Body is trying to pump. Results in the high blood sugar. So whenever there is a high blood sugar, automatically in the urine also, because all the blood flow will go to the urine, go to the kidney only. So in the kidney from urine also, you will get a high sugar. Okay, that was the problem. The types of diabetes mellitus. Diabetes mellitus types. Again, there is a two types are there. In type 1 diabetes, type 2 diabetes. What happened here? Type 1 diabetes, what happened? Pancreas will not secrete the sufficient amount of the insulin. That's why this is called a insulin dependent diabetes. And whereas a type 2 is a non-insulin dependent diabetes. In type 1, it is called a insulin dependent type 1. 1 indicates insulin, like that you can remember. Insulin dependent diabetes mellitus, IDDM. Type 1. 1 means insulin. That's it. So insulin dependent diabetes mellitus. Because there was no insulin, he has to compulsory, the patient has to consume the insulin from outside. Inside, because inside pancreas is, because you are either so many activities, so many multifactorial reason. Okay, so once there was a lack of the insulin, the glucose will not enter into the muscle cell or body cells. So glucose will be there in the body only. Okay, so in the blood circulation only. So it leads to higher blood sugar. Okay, this is normal in a healthy. What happened? Insulin will secrete. So insulin receptors will be there here. That insulin receptors, when the insulin will come and bind here to the insulin receptor, automatically sugar will enter. Whereas here this is a problem. Type 2, insulin is ready, whereas the glucose cannot enter, because insulin receptor problems is there. Cell failed to respond to insulin properly. That was the main problem. That's why for this also solution is walking. Exercise, walking, yoga, pranayama, mandatory, compulsory, right? Okay. So this is called a type 2 diabetes, non-insulin dependent diabetes. Causes of diabetes institutes, mainly two causes are there: agent factors and personal factors. Agent factors are neoplasma cancer of pancreas, pancreatitis. It is one of the biggest diseases. Pancreas will become a rigid, will become a solid, will become a hybrid. It cannot secrete the insulin. Okay, pancreatitis. Cystic fibrosis will be there in the pancreasis. Fibers will be come and it clog in the pancreas. Okay, viral infection, it also leads to this one. Genetic defects in the insulin genes, autoimmunity, or this is a very biggest problem, autoimmunity. Own beta cells of their own body is destroyed. Biggest problem. Practically, I observed in many clinically also. Autoimmunity, overaction of the immune system, our body own immune system. Chemical agents like a streptozotocin, okay, streptozotocin, cyanide, and personal factors like a mental stress, very important, very important. Job or family, lack of exercise, high intake of the fat, trans fats, all the carbohydrates converted into fats, trans fats, it is called as a carbohydrate. Carbohydrate is not direct to fat, it is a trans fat, it is converted into the fat later in the body. Malnutrition in the childhood, nutritional deficiency, surgery removal of the pancreas, it is a pancreatectomy, it is called as a pancreatectomy. Excess intake of alcohol, smoking, lifestyle changes, environmental factors, all these causes to. And symptoms of diabetes mellitus: always tired, you will feel you will tired. I tired, I did so many, actually you didn't did any work, but you will feel that you completed a 1 hour work or 2 hours work, like that. Okay. Always hungry, this is a very biggest symptom. Hungry, 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 they are hungry like anything. Okay. And vaginal infections for women, sexual problems, okay, for male, numbness or tingling of the hands or feet, numbness, this is very biggest symptoms. Sudden weight loss, you will become lean. All these factors you can observe in the sugar. This is very very important, this is important, this is important. Hungry is important. Okay, these three are main. Always thirsty, I told, no, thirsty is common in both diabetes mellitus and diabetes insipidus. Blurred vision, you can see the flowers like this, shaking flowers, it is also called as shaking flowers. Okay. Wounds, it will not heal. So if you have a scare, if you see that is a wound, 1 week no cure, second week same, no cure, third week no cure, fourth week no cure, no cure at all, your wound will not be healed. Frequent urination, that is also the problems of that. Okay. Yeah, sorry. And diagnosis, very important tests. See, the beautiful lady may check your blood sample. Okay, get blood sugar, give your test to beautiful ladies and test it. For that you need diabetes. Okay. Diagnosis test for diabetes mellitus: oral glucose tolerance tests, number one. For this is for type 1, this is for type 2. Oral glucose tolerance tests, auto antibody tests, these are the two specific very important for type 1 diabetes, whereas at common, these are the common: HbA1c, blood sugar, fasting, post random test, urine sugar test, these are the common for type 2, type 1, right? Oral glucose tolerance tests, first one: no food or drink for 8 to 12 hours, first of all, prior to the tests. No food, no drink, nothing, nothing should enter into your mouth. Drinking glucose, now after 12 hours you are drinking a glucose. Now blood is tested for 2 hours later, after 2 hours of the taking of a glucose, then it has to start. High glucose level, potential diabetes are there. Okay, so it is a less than 100 mg, no diabetes. 100 to 120 means you are pre-diabetes. Definitely, you not definitely, but you may have a chance to get a diabetes. That is called a pre-diabetes. Okay, and greater than 125, it is a thing. All values are important. Okay, it is just, it's similar to normal values only. It's similar to, so that easily you can remember. Whereas antibody test, antibody, our body produces an autoimmune system, no, our body produces own antibodies against our own body cells. Body will feel our beta islets of Langerhans as an antigens, our body immune system, and it starts fighting against it. So all beta cells are destroyed. No insulin secretion, you have to take the insulin from outside. And this is an antibody array. How to do a test on that? This is a patient's antibody antigen complex. This is antigen antibody. This is antibody. Both are in blue color. You can see this is a round shape. So how to detect this means by using ELISA like test. So islets of 4 antibodies is there. 4 auto antibodies are called as a markers. These are very very important for all the competitive examination. These are the antibodies: GAD65, IAA, ICA, okay, IA2A. Among, if any 1 or 2 or 3 or 4 is there, that's it. Okay, it is a type 1 diabetes. How to do this? Very simple. You have to mix a patient blood with fluorescent. This you have to select. This is the main agent. So this agent as well as a patient blood you have to mix. Okay. So when you mix this fluorescent, only this fluorescent, and you filter it. So when you filter it, what happens? If antibody is not there, there is no such a big complex here. No fluorescence here. See, here you have to take this one sample and do the fluorescence fluorometry. Fluorescence test you can be do. Test for fluorescence detection. If yes, test is there, then the entire structure is present. So once there is a this one, then only there is a formation of a fluorescent. If there is no this complex, this easily filtered here. So you will get a fluorescence here. It is a if fluorescence is here, no diabetes. If fluorescence is here, diabetes is there. This is the main reason. This point you have to be collect, do the fluorescence test. If yes, fluorescence is there, don't take this one only. If yes, antibody is present, because in the filtration, everything, all the constructions like structured like are will be holded here. Okay. A1C test, super test. This is very excellent test. It is also called as a HB, hemoglobin A1 test. What happens in the diabetic patient? Glucose will start sitting on the RBC like this. HbA1c. That's why this is called a hemoglobin A1C. Hemoglobin A1C or glycated hemoglobin test. Okay. What is the principle here? During the sugar, blood sugar, this is actually 3 months once or 6 months once. See here, test duration is once in, sorry here, 3 to 6 months. Test duration is one time you can be do this test, you can undergo either one time in the 3 months or one time in the 6 months, 3 to 6 months, not the 36 months, right? So hemoglobin A1C test is glycated hemoglobin test. Principle is a glycated hemoglobin is a form of hemoglobin. This is called as a glycated hemoglobin. This hemoglobin they will find. Okay, if higher the glucose level, like that. This is exactly the test. Instead of taking a blood sugar level, diabetes, these are the values for this A1C test. Diabetes 6.5, normal below 5.7, 5.7. This is exact test. 5.7 to 6.4, greater than 6.5. These are the standards. You have to note down all these things. You can take a blood glucose chart that you know very well. Fasting after eating, 2 to 3 hours after eating. These two are very important. Fasting and 2 to 3 hours. Okay, this is random generally. Okay, but these two are important. Second column and fourth column are very very important. 80 to 100. If anybody asks, you should be able to tell. That is a urine sample. In urine sample, these are the values, quantity of a glucose in the urine, no change in color, green color, yellow color, thick yellow color, orange or red color, brick red color. This is based on the Benedict's test. So sugar value, no sugar, 250, 200, these values you have to be read. Okay, you can be note down that value. And prevention of diabetes, mainly three are there. It is a combination of three. Then only prevention of diabetes is completely possible. Otherwise, only one or two, if you are following, it's waste. Not complete result you will not get. Mental activity, stress, very important. Physical activity, Paschimottanasana, excellent for diabetes. Paschimottanasana. Your pancreas here, see, entire pressure now it falls on your pancreas, on the stomach. So that high blood supply to the pancreas. High blood supply. Paschimottanasana, very important. Healthy food. These are the three that we will see one by one. Mental activity, self-confidence, very important. Positive thinking, being optimistic, not pessimistic. Okay, optimistic. Don't think too much. Unnecessary thoughts. Okay, I failed in subject. I got less mark. Don't think that. Okay, avoid anxiety, avoid stress. Do enjoy, help the others like that. Okay, mental stress. Feel relaxed. Physical activity, normal body activity, normal body weight you have to do, normal body mass index, walking, jogging 45 minutes or 30 minutes skipping or 30 minutes of swimming. If a condition is very serious, high levels of blood sugar, you have to do combination of this. 30 minutes pranayama, 30 minutes of yoga, Surya Namaskar and Paschimottanasana. This is very, very important. Paschimottanasana. Healthy food, nutritional habit. Nutritions, you have to take high fiber food. Fiber food should be high. Medium protein food. Proteins you have to avoid the sweets, fats, trans fats, carbohydrates. More fruits. Fruits, not the sweet fruits. apple, guava, papaya. These are three are very, very important for especially sugar patients. Don't take any other fruits. Okay, these are the three top for sugar. Top number one. Apple is always number one. More vegetables, leafy vegetables. Avoid smoking alcohol. Eliminate the tin food or canned food. Eliminate the preserved food. This is a complete diet plan. Prevention of the diabetes. Breakfast, what you have to take? Idli. Only two idli, not four, five, six. Okay. Fruits compulsory. Even though you miss the idli, nothing will happen. But don't miss this. Okay, so and mid meal at 11 a.m. only, not this many fruits. Here only for symbol I have shown one or two. That's it. Okay, sprouts you can be take. This is a protein food. And lunch only 1 cup. See here, only 1 cup along with the roti, or you can replace it with the roti or pulka. And papad is there, and curd, and many curries, and drink. These are the some sweet, not sweet. These are some rasam like sambar or rasam like that. Okay, and here you can take entire the meals. Okay, evening fruits. Okay, and dinner. They are very lucky. 1, 2, 3, 4, 5 times they are taking. Okay, dinner also same. Brown rice you have to use. Brown rice, sugar patient. Don't use any at any circumstances. Don't use white rice. Okay, these are the treatment of diabetes mellitus. This is available in my channel playlist, pharmacology playlist. There I have told you what are the sulfonylureas, how to remember all these things. Okay, and take a screenshot. Prevention is main thing here, the subject name. That's why you have to highlight the prevention only here, right? Okay, so I'll end my session.